Alright, welcome to another video. I'm Dr. Ford, the NICU Doc. So today we're going to be talking about coronavirus during pregnancy and also the transmission that can happen to babies. So let's get to it. So in today's video, we're going to be talking about, number one, the coronavirus structure. Number two, what are the symptoms of coronavirus during pregnancy? 3, what are the risks of having the virus during the pregnancy? Number 4, what is the transmission, if any, of coronavirus to babies? And number 5, what are the symptoms of newborns with coronavirus infection? And stick around to the end of the video, because I'm going to give you a neat bonus, and that is, can coronavirus actually be transmitted through maternal breast milk? Alright, make sure you stick around to the end to know the answer. Let's get to today's video. So coronavirus is a single-stranded RNA virus that's spherical in shape. It is surrounded by these spikes or S proteins, and it enters into the cell, reproduces, and then basically damages the cell and then goes to infect another cell where it again continues to reproduce. And that's why it causes lung disease when it enters through the lungs. It's basically damaging the tissue of the lungs, making it even harder and harder for you to be able to breathe and get oxygen in, oxygenate the rest of the organs. So that's how coronavirus enters the organism and infects and causes some of the symptoms. If you want to know more, you can go ahead and hit the card right up here and you'll look at what are the symptoms of coronavirus and maybe some other medications that we can use like surfactant. It could possibly prevent infection of coronavirus. What are the symptoms of pregnant women with coronavirus infection? So actually you'd be surprised, but they're actually pretty much the same as women who are not pregnant. There was a nice systematic review that's basically looking at a bunch of smaller studies put together. So this systematic review actually evaluated 33 different studies with approximately 252 pregnant women who actually gave birth. And of those women, 89% of those were found to be positive on a nasopharyngeal swab. That's where you get a small sample of fluid from the nose. And the rest were found to be positive just from an X-ray that was very indicative for a pneumonia of the type that we're seeing with coronavirus infection. So the most common symptom that was found in these 252 pregnant women that delivered was fever. That was found in about 67% of women. And then the second most common was cough, found in about 66% of women. There were other symptoms associated with the fever and the cough, and that was you could have diarrhea, you could have dyspnea or problems with breathing, you could also have nausea, vomiting, and other smaller percentages of symptoms. But the most common were these two, cough and fever. So what are the risks of pregnancy and getting coronavirus infection? So just being pregnant in itself, you're not more susceptible to getting the infection. However, if you are pregnant, there are two common problems that have been seen in the smaller studies. Number one is premature rupture of membranes. That means the membranes of the amniotic sac that holds the baby tears before it should. It should hold you all the way until delivery, but it tears beforehand. And that may be associated with the second problem, and that is you are born premature. That means you're born before 37 weeks gestational age. So we know getting the coronavirus in general increases the risk of dying, of mortality, and having bad lung disease. However, in pregnancy, there isn't a greater increase than the general population as far as the mortality is concerned, but it has been shown to be associated 3 times more common needing a breathing tube or mechanical ventilation to be able to help you breathe. So regarding the transmission of coronavirus infection from pregnancy to the baby, this is a bit of a tricky subject just because we don't know a whole lot about this. We're really getting information from small studies. Some small studies have actually shown that if the mother is positive, when they test the baby, they may be symptomatic for different things. They may have different problems, but when they actually test them for coronavirus infection, it's negative. They don't really find anything. In a small study from Iran of 31 infected mothers, they actually showed that no babies developed the coronavirus infection. All the testing done on babies were negative. When you look at a systematic review, which is again looking at smaller studies put together, what they found was that about 1.4% of babies were found to be positive within the first couple of days right after delivery. Of those babies that were turned positive, when looking at the placenta and all the fluids involved during delivery, they were negative. So it's most likely that that positivity, when they became positive, happened very soon after birth and not necessarily because of a vertical transmission. What that means is that the mother actually passed that virus to the baby. What's really key to this is that placenta was negative, and the placenta in general acts as a sieve from the mother to the baby. It sort of cleans some of the blood that passes from the mom to the baby. Not for every type of virus, but it helps to determine what's been traveling through that. And so the fact that it's negative, it's really, really unlikely that this vertical transmission is happening. So what about the babies that are born to mothers who are positive for coronavirus infection? As I mentioned before, vertical transmission, passing it from the mom through the placenta to the baby, doesn't seem to occur. But we do know that babies that are born to mothers that are positive can also be sick. And most likely it's not the virus causing the baby to be sick, but it's really because mom is already starting out sick. A lot of these moms can have respiratory problems, needing a mechanical ventilation, meaning a machine to be able to breathe. They could end up in the intensive care unit, low oxygen, and that obviously affects the baby. So what we actually have seen with babies is that about 3% of babies do get admitted into the intensive care unit, and 1% of those can actually have mechanical ventilation, meaning they need a breathing tube to be able to breathe. However, this is tough to be able to discern whether it's the virus itself or whether it's really because mom was already sick to begin with, and obviously the baby comes out with not getting great oxygen levels because of mom's illness. Also, babies are born premature because mom had the virus. And so they, in general, can have premature lungs, needing ventilation to be able to breathe, needing an intensive care unit to be able to survive. And so this data is very tricky to interpret. For the most part, we know that just being born to a mother who has coronavirus infection, if mom is asymptomatic or minimal symptoms, the babies are going to do very well. They do fine. They get to go home. So I want to thank you for sticking around through the whole video. So here's the bonus for you. And that is, can coronavirus pass through maternal breast milk? And the answer is no. When testing the actual milk for the virus, there is no indication that there's any virus there at all. So you are able to give maternal breast milk even if mom is positive. You can give that maternal breast milk to the baby. So that means that if mother is infected with coronavirus, she cannot actually breastfeed the baby per se unless there's no other option. But if there's another person that can assist, she can go ahead and pump that milk, and that other person, significant other or family member, can give that breast milk through the bottle to the baby, at least until she's able to surpass her infection, she's quarantined, and just follows all the regulations from the adult doctors for her. Okay, thanks again for watching. Really appreciate sticking around. And again, if you like these videos, please go ahead and like, go ahead and subscribe, hit that notification button. You know the deal. So we're done with today's video, and thank you again for watching, and we'll see you with the next one.